Hey do-gooders, do I need an orthodontist or a dentist? Let's find out. Buckle up, time for some PFOing so you know where you're going. I'm your local orthodontist answering your questions about orthodontics and life. I'm the guy. Today's question is, do I need a dentist or an orthodontist? It seems like most people understand the difference between a general dentist and an orthodontist, but every once in a while we still get people that show up in our office that are looking for a general dentist and not for an orthodontist. The way I want to answer this question today is by giving some basic background information and then answering questions to help you know if you need a dentist or an orthodontist. So, what is a dentist?
Dentist over there! What's a dentist? What is that?
Usually the dentist is someone who has accomplished a 4-year college undergraduate degree. Then they work on a 3 to 4 year dental school program. Upon completion, they receive a dental license that allows them to practice all aspects of dentistry. Does that make sense? So a general dentist is generally licensed to do all the different aspects of dentistry, like fillings, cleanings, crowns, extractions, straightened teeth, root canals, implants, and so on. Of course, there may be a few caveats to this, including where your dentist is practicing, what state they belong to. Different states may have different rules that affect what a general dentist can do or practice. Then, after dental school is completed, you have the option of either practicing all those things we just talked about, or applying to a dental specialty program. In the different specialty programs, a dentist can then specialize in their training for a specific aspect of dentistry. So, pop quiz. Which one? Which one?
Which one? Which one?
Do you know which dental specialist does root canals? Did you say endodontist? If you did, that's correct. Do you know which specialist specializes in gum and bone tissue? The periodontist. What about who does the jaw surgeries and is the expert on wisdom tooth removal? Any guesses? That's right, the oral surgeon. Now this one's a tricky one. What about the tooth straightener / dental facial orthopedist? You're looking at him, baby. The orthodontist. What about a full mouth reconstruction? Now, I'm not talking about jaw reconstruction. I'm talking about maybe there are a lot of teeth missing. Maybe we need lots of implants and lots of new crowns. There's actually a specialist for that. They're called prosthodontists. Then we also have a specialty that focuses on treatment of baby teeth. Can you guess? Pediatric dentist. There are other specialists in the field of dentistry. The ones that we've talked about are some of the main ones. Going back to orthodontics. To become an orthodontist, most residency programs after dental school are 2 to 3 years. During this time, a dentist will train and review biology, the anatomy, specific techniques and materials associated with tooth movement, and then apply those to patients in residency. After completion of an orthodontic residency, the dentist will receive a certificate that certifies that they are an orthodontic specialist. They have completed the training and they can market themselves as a legitimate orthodontist.
Congratulations, Officer Hops. I won't let you down. This has been my dream since I was a kid.
I didn't want my certificate for law enforcement. It has been my dream to get that certificate to become an orthodontist. I just love moving teeth. So, how do you know which type of dentist that you need? Here's some questions. What if you're asking yourself, I need a cleaning?
Scrub couldn't hide.
Who should I go to? Definitely your dentist, your general dentist. And if you happen to have a pediatric dentist, they can definitely help you with good cleanings. What if I need a filling? Well, in that case, you would also go to your general dentist or pediatric dentist for those with lots of baby teeth. What if I need a single crown? Trick question, go to Narnia. Actually, did you see in that video, Lucy, she had the gap between her teeth. At her age, gaps between teeth may be a normal aspect of development. Kind of cool. So, but seriously, if you needed a crown, your general dentist, or sometimes baby teeth get special silver crowns. So pediatric dentist, if you got baby teeth, or if you needed lots of crowns, like I said, full mouth reconstruction, sometimes the prosthodontist, those are great specialists to see for that. What if you want a veneer? Your general dentist, great great place to start. What if you want your teeth whitened? Actually, you don't need to go to your dentist for this. There are certain products in the market that you can get at stores, like toothpaste and whitening strips or rinses that are supposed to help whiten your teeth. But if you're looking for the heavy industrial grade whitening, then maybe you should go to your general dentist. What if you're asking, I need an implant, where should I go? Well, you can always start with your general dentist. Some dentists receive training to place implants. That being said, there are specialists like periodontists or prosthodontists or oral surgeons who may feel more comfortable placing certain types of implants or a certain number of implants. So depending on the complexity of your case, you may go to all of those different specialists or dentists. What if I need a tooth pulled or extracted?
What the? Ah! Well, that's one way to pull a tooth.
You can visit your general dentist or pediatric dentist for baby teeth. You can also go to the oral surgeon or periodontist. Oral surgeons generally take the more complex extractions, like if a wisdom tooth or a tooth is buried way down deep in the bone. What if you need a root canal?
Yes! Boy, oh boy, oh boy, oh
What do
boy.
we got?
Root canal, and by the looks of those x-rays, it's not going to be pretty.
The endodontist is the specialist in this case, although some general dentists will do certain root canals. So you can start with your general dentist, and if they feel uncomfortable helping you out, then you can always see an endodontist. What if you need a gum grafting procedure? Well, that's the periodontist. So what if you need jaw surgery? You definitely want an oral surgeon and not somebody who is pretending to be a surgeon.
Thank you, doctor.
That probably wouldn't work out very well. What if I have TMJ? That is the million-dollar question. First, actually, we all have a TMJ. In fact, we have two TMJs. They're the joints that connect our lower jaw to our skull. All right, so everybody has a TMJ. But certain people, lots of people, have problems with their TMJs. Pain, soreness, things like that. So who do you go to for TMJ problems? Well, right now, there's not a TMJ specific dental specialist, as far as I'm aware. If it is, it's probably pretty new and not very accessible. So dentists, oral surgeons, orthodontists, some of these dental professionals get exposure to training as it relates to the TMJs. But the reality is that there's so much we still don't know about the TMJ and all the things that contribute to problems associated with them, that be careful as you go and seek treatment. Some of the treatment options don't fix your problem completely. They just try to help you deal with the problem. Some solutions are irreversible, meaning that you could attempt certain surgical procedures to help with your TMJ problems. In my opinion, whenever you have questions about your TMJ, it's probably a good idea to get multiple opinions. What if you're taking out all your teeth or you're missing lots of teeth again, and you're looking for dentures or lots of implants and crowns to allow you to continue to function? It has something to smile with. A prosthodontist is definitely a great place to start. Or you could start with your general dentist, and if they feel uncomfortable performing the procedure, they can send you to the specialist, the prosthodontist. And what if you need straight teeth or a spacer? Or what if you need a retainer? This sounds like a job for...
This looks like a job for Superman.
Okay, Superman or an orthodontist will be just fine to help you with this problem. Some general dentists may help out, but orthodontists are definitely in a position to help you resolve these issues. In summary, the general dentist, your general dentist, is in a good position to handle lots of problems and issues for you, or at least they have good connections to other dental specialists to help you resolve your concerns. Be sure to ask the right questions to help you find the right dental professional for you. All right, do good, live good. Let's talk about specialization. That's a big word. We live in a wonderful world where individuals can become specialists in all sorts of different aspects of life. We just talked about all the different dental specialists that can help you with different problems related to your jaws and your teeth. We've got different medical specialists that can help you out with your heart, your lungs, your brain, and other parts of your body to help you be happy and healthy. We've got different teaching specialists. We've got math teachers, science teachers, anatomy and physiology. We've got computer teachers. We've got so many teachers that can help us learn all of the wonderful things to learn in life. You may have to do a little bit of work to sort through all this information. to find out what's best for you. But that's okay. You know how I feel about work. That's all I've got. Drink it up. Just a little PFOing so you know where you're going. Packard out.